utilized and implemented. So this is our indigenous definition of health. This is a new phenomena that we will be advocating. Ladies and gentlemen, Pakistan's maternal mortality stands at 167 per 100,000. Though we have covered much ground in reducing it from 287 per 100,000, but we should not be self-complacent and sanguine, because it's still way beyond the SDG target of 70 per 100,000. So a lot of ground has to be covered by us. If we look at the causes of this high maternal mortality, we see postpartum hemorrhage, hypertension, sepsis, infection, unsafe abortion. But we also see the ignored component of that, and that's the non-communicable diseases, of which breast cancer and cervical cancer resonate high. We have now a backlog of 365,000 persons infected with breast cancer. The mortality associated with breast cancer is 4.52%. We have to be doing some innovation, and as I have put forward a philosophical change in the ministry, that's as a strategy, we will be moving from verticality into integration, from silos to meaningful collaboration, from reactiveness to proactiveness, and from stereotyping to innovation. And that philosophy will be inculcated into this effort as well. So of the main causes of this high and unacceptable prevalence of breast cancer and cervical cancer in our society, there are gaps in our policy, there are gaps in the supplies, and there are gaps in the demand. So how are we going to address that? I will put forward my vision of that. So at the policy level, first of all, we have many task forces, but I'll refer to the polio one. The polio one is the most high-powered and functional task force. I would like the non-communicable diseases also to be incorporated into a single high-powered, effective, efficient platform, and the task force can be led by the senior leadership of the country, and that would be holistic, and therein the power of synergy will also flow, because each program would provide synergistic support to the other. So that's one. The second part related to the policy gap is we do have national action plans for many programs, but we would like the national action plans to be redefined in the context of responsibilities, milestones, targets, indicators. And a thorough review of that can be enshrined, a quarterly review of that. And that's how we would progress. The third one at the policy level, Excellencies, we have a universal health insurance program, but now we are making it a uniform national universal health insurance program. So we have decided that non-communicable diseases, and especially catering for the needs of cervical cancer and breast cancer, will be inculcated into it, and a package of healthcare services will be part of it. At the operational and management level, also some initiatives we have already taken and some are on the pipeline. Like, we have included cervical cancer and breast cancer screening, early detection and treatment in the essential package of healthcare services that we have developed, and it's being now rolled down. By the way, we have a new program of revamped primary healthcare system. It's in the pipeline. It will be announced, inshallah, very soon. And this essential package of healthcare services will be uniformly implemented in all those health facilities. And this cervical cancer and breast cancer are dual part of it.
निगरान वफाकी वज़ीर सेहत डॉक्टर नदीम जान तकरीब से खिताब कर रहे हैं। उन्होंने कहा